Hi, I'm Dr. Connie Stapleton, and I'll be meeting with you soon as part of your preparation for your bariatric surgery. I'm making this presentation because partly I get tired of saying the same thing time after time, week after week, to person after person. Mostly, however, my patients tell me that the information that I share with you today means a lot more down the road. Sometimes 6 months after you've had the surgery, sometimes a year after the surgery, and from my perspective, definitely 2 years beyond the surgery and afterward. So I want you to be able to watch this time after time and get information as you need it. When I talk to people preparing for the surgery, I like to compare them to people who are preparing to get married. Think of yourself if you're married when you were getting ready to get married, or if you know somebody who's engaged now, think of that young couple. People tend to go into marriage kind of a little giddy, thinking about, oh my gosh, I'm getting ready to spend my life with my beloved. We are going to be different than other couples. They are absolutely giddy with excitement and they are in love. They know that 50% of people in this country tend to end up getting divorced, but they're going to be different. They're prepared. They've been to premarital counseling. They're not going to have the problems that the rest of us tend to have. They know that they are in for a lifetime of happily ever after. Well, anybody who's been married for any length of time knows that that's a little naive. This pre-wedded bliss, we kind of tend to think of pre-wedded delusion. Actually, marriage is a wonderful thing. I've been married for 25 years and it gets better all the time. However, throughout that 25 years, there have been times that have been difficult. Marriage can be incredible, but if you're married, you know that it takes consistent effort to make it that way, and there are difficult times. There are going to be rough patches. We just accept it. We learn to get through the hard times. We're willing to do what it takes to make our marriages stronger and for them to be good. Well, at this point, you're sort of like the person getting ready to get married. You're excited about your surgery. You're ready to get on with it. You've read Weight Loss for Dummies. You've seen the doctor. You've been to a group presentation. You know the facts. You know that there are possible potential side effects that sometimes are negative with the surgery. And you know that you may gain some of your weight back. In fact, some people gain a lot of their weight back, but you are not going to be one of them. You are going to be a wonderful post-surgical patient. You've read, you've prepared, you've joined all the online support groups, and you've been poked and prodded by your doctor more than the pills to bury doughboy. So at this point, you're thinking, let's get on with it already. I'm ready to have this surgery, and it's time. My goal is not to dampen your spirits or burst your bubble about being excited about this surgery. I'm a big fan of this surgery. In fact, I know that without this surgery, chances are not good that you will lose this weight. My job in this preparation period is to kind of help you with the facts that are not related necessarily to the medical aspects of your surgery, but to help you prepare for your life after the surgery. You're going to benefit from this now, as I said, but a lot of this information that we talk about will make more sense to you later on. But listen now and watch it and focus on any questions that you have so when we meet in person, you can have those questions ready. Okay, as I said, most of your preparation at this point is physiologically based. After all, the surgery is a big part of this procedure, and you want your doctor to be focused on the surgical aspects. However, even though losing weight may be what you consider your ultimate goal, I want you to think beyond that to keeping your weight off, because honestly, your health and all the accompanying aspects of your health have to be long-term. It's not just about losing the weight. It's more about keeping your weight off, because keeping your weight off and improving your health, getting rid of the high blood pressure, decreasing your cholesterol, getting rid of the 7 to 10 to 20 medications that you're taking, getting rid of that diabetes, that's going to be a benefit to you and to everybody in your life. So there's a lot more to this preparation for the bariatric surgery than just the medical aspects. Okay, weight loss surgery is becoming something that insurance companies have gotten their hands in, and they require that you have a psychological evaluation. Even if you're not using your insurance to pay for your surgery, this part of it is very important. You may or may not have an understanding of the psychological aspects that are related to your weight loss, but the insurance companies do understand that once you've had the surgery, there's a reason that a lot of people are gaining their weight back. Here are some of the questions that we'll be talking about, and these are specifically some of the things that the insurance companies want you to know, but this information is important to me as well, and I'll let you know more about why that is when we meet. But take a minute now, write down the answers to these questions, or give them a lot of thought. First of all, I want you to ask yourself, have you been able to lose weight in the past? The fact is, most of you have. Most people who come in to have bariatric surgery have lost weight in the past. So what the insurance company is interested in knowing, and what you and I need to talk about, is you've been able to lose your weight in the past. What is it that's prevented you from keeping that weight off? Okay, because those things are going to be important after you have the weight loss surgery as well. Secondly, are you well informed about the surgical weight loss procedures and about the possible side effects? I'm sure you are much more aware about those things at this point because you've talked to your doctor, you've probably read Weight Loss for Dummies, maybe you're online with obesityhelp.com. You probably have a lot of information about that. Thirdly, are you aware of the potential for surgical serious complications? Are you prepared for the dietary restrictions you'll have to endure after the surgery? And are you aware that occasionally there's a failure for people to lose their weight? Also, fourth, do you have a support group? Do you have people who are going to support you after you have your surgery? Support can come in a number of ways. There are online support groups like obesityhelp.com or lapbandtalk.com, and all of your local communities have support groups. It's really important that you meet people at these, get their phone numbers, and talk to them after you have the surgery, because they'll be able to give you answers to questions that you may not even have already thought of yet. Okay, also, and this is important, are you determined? Are you determined to lose the weight and improve your health? Now, I doubt very many of you are going to tell me at this point in time, no, I'm not determined. I know, like our premarital couple, you are determined to do this, and you're determined to do it well. I'm here to tell you that it's not as easy as it sounds. You know, if you've had children or if you've been married, that that's the case. It may sound good, but until you go through it, it's not as easy as it seems. That doesn't mean don't do it. It just means know the reality of it. Okay, an important question. Do you know what the surgery does and what the surgery does not? Now, I'm going to say this many times throughout this presentation, and again when we meet. The surgery basically does one thing and does one thing only. The surgery limits the amount of food that you can put into your body at one time. And that's about all it does. You either do the rest or you don't. That will come later. Okay. Next question. Do you have appropriate goals and realistic expectations? It's not very realistic to think that, 3 days after the surgery you're going to have lost 50 pounds. It is realistic to expect that 3 or 4 months out from the surgery you will have lost that much weight. But your goals and your expectations are things that we'll talk about when we meet in person. Are you willing, do you have the determination to make a plan for what you're going to eat and follow that plan? That again sounds easy, but it's not that easy. And after the surgery people say, well, I really don't have time for that. We're going to discuss that because you're going to have to make time for that. Are you prepared and are you willing to make time for exercise? Again, a lot of us don't like to exercise, but it's a necessity. We'll talk about that more as we go along too.